All right. Good morning. In case you're just joining us, we are so glad that you created time for this second interview that we have for the show this Wednesday morning. Every week on Wednesday, we focus on matters health and lifestyle. We are happy that you created time to join us. And if you have been watching the show since we started, we really appreciate your time and company. Now, what we want to talk about is something that I know each and every one of us takes very seriously when it comes to matters hair, when it comes to matters skin, when it comes to how we look. This is something that we are very sensitive to. It doesn't matter who you are, if you're a man, you're a woman, you're a child, an adult. Every person wants to look good, and there is that pressure to always achieve the best when it comes to your aesthetic. And in studio with me this morning, I will be talking to a doctor who does a lot when it comes to something that has been quite, picking up in the last few months or years, if I may say so, clinical aesthetics. You've heard about that. If you've ever gone through an experience of a receding hairline, or you just want to look youthful and maintain and sustain that, and there are things out there that people have tried and they have backfired on them, and you're going to be talking about some of the issues that are emerging when it comes to just having a healthy hair, having healthy skin. What are the safety concerns? What are some of the myths and the stereotypes when it comes to clinical aesthetics? And to help me answer those very pertinent questions, I'm having this sit down with Dr. Ashni Malde. She is an aesthetic doctor and also the managing director of Tia Clinics. Karibu sana.
Thank you so much.
All right.
Hi.
So we want to start straight away, and usually what we do on the show here is to go back to the basics and to break down things for people to understand. So when we are talking about beauty, many would not think about it in the medical context. So that is where I want you to take us in. So talk to us basically what you understand, or how you'd simply put, clinical aesthetics to mean. What is it all about?
Okay, so I always tell my patients that you have to look good in your bare skin. And makeup will only just make you look much better. Mm-hmm. And that's what medical aesthetics is about. Have really good skin. There's this huge trend about glass skin these days. But all in all, we tackle all kinds of problems, from pimples, acne, open pores, just hyperpigmentation, just generally dull-looking skin. Of course, with hair issues as well. And we say hair is your dignity. So we try to restore your hair, and we do that in many ways possible. So when we say aesthetics and when we say medical aesthetics, we just want you to have good grade skin. We want you to have the optimum skin health that you can have. And yeah, that's why we're here.
Mm-hmm.
Yeah.
Something you mentioned there that really stands out is that, makeup just should enhance, how you look. Talk to us more about that basic foundation, feeling beautiful, first of all, and being beautiful before adding any other thing. How significant is that, and how do you get to achieve that?
Okay, so again, there's this huge hype about skin barrier and restoring skin barrier or enhancing skin barrier. And that's actually the most important thing when it comes to skin health. So when we say skin barrier, it's always necessary to cleanse, exfoliate, and hydrate your skin. I know back in the day, we've all lived in the age where only Vaseline was, or something that would just hydrate the skin, and that was good enough for us. But now there's so much of advancement, and not just in form of procedures or in-house treatments, but also products that you can use just to have good, healthy skin. Mm-hmm. And when you do makeup now, it only enhances your look. Mm-hmm. Yeah, so
great.
Skin barrier.
Yeah, so doctor, we were talking about, clinical aesthetics, and some would find it an area that is still very new, though the trend have shown that it is slowly picking up. Probably tell us a bit about how you interpret, what you have observed over time, from the time this term was introduced to now. How is the situation, and are people, coming forth, seeking, services in terms of just how to go that direction in improving how they look and how they feel?
Yes, I started 2020 in Kenya, and it was a rough road because people wouldn't understand. People thought you'd get cancer out of doing a hair transplant, or you'll have brain tumor out of doing a hair transplant, or even when it came to skin, they didn't understand that there were advancements in terms of having good, healthy skin and the glass skin that everybody wants these days and everybody talks about.
Yeah.
But yes, awareness has really improved. I think people are getting really educated. It's a good thing because we need to help people improve their skin. It also affects so many people with their self-confidence, but they just don't know where to go and what to do. And so, yes, I would say this year has been good. We've had so many people know about what they want, how they want to do it, you know, and how they want just good skin, good hair. So it's a good journey, and I feel we will get there where everybody feels it's really important. Yeah.
Have you had moments of people raising some ethical or cultural concerns about, you know, aesthetical medicine or clinical aesthetics? Maybe some would say maybe you're trying to change how you were created or something like that. And how do you comment on this, and how do you demystify some of these stereotypes and myths?
Yeah, I get that a lot.
Yeah?
I get comments where people say, this is the way God made you, so you're supposed to stay that way. But I say that, yes, God made you this way, but you're supposed to look good. You're supposed to just be able to present yourself somewhere. It shouldn't bring you down. And that's why we're here, just to help you. We're not trying to be God, but we're there to help you. But I think with time, people improve. There is always going to be that segment of people who will always be against it. Whether it's, you know, saying that this is the way nature has to have you, or, you know, ethics, or, you know, just community-based. But it doesn't really hinder us. We also just kind of allow people to accept what they want. Yeah.
All right. Let's talk about, you know, some of the key issues that probably are dealt with when it comes to clinical aesthetics. One of the things that I said even when we were starting this program is, you know, the health of the hair and the skin is very pivotal for everybody.
Yeah.
You know, particularly women take their hair very, very seriously. And the biggest challenge that majority of women have, even men, if you ask me, is the issue of hair loss. And there's a lot that has been done in the world of just managing hair loss and treating it and preventing even further loss. But let's begin from where it all begins. How do we get to, you know, a situation where somebody is losing hair in a rate that they can't even control? What are some of the main causes of hair loss from what you've been able to discover so far?
Okay, so with men, it's just general balding. But balding has been so enhanced even with men because of stress, lifestyle, diet. These are the major factors, actually. And so initially we used to factor in genetics and say, oh, because my dad is balding is why I'm balding. But it's no more like that. I often have patients who come in and say, my dad has a head full of hair and I have no hair at all. So like I said, it's these factors, generally stress, lifestyle, and diet, that really contribute. You also see a lot of young boys just wearing caps all the time, and it's suffocating the hair. So back in the day, we would see balding starting from the 40s or the 50s or the 60s. And now you won't believe, I have patients as young as 18, 17 who are as bald as you would see a 70-year-old back in the day.
So it's no longer an age issue.
It's no longer.
It's increasingly being observed in even the younger population.
It's actually a larger chunk of the younger population, and it's only mainly because of lifestyle and stress and diet. And that's what really contributes to the hair loss in men. As for women and African culture, I don't mean to be biased, but it's only because of the culture, because of the traction, the braiding, the weaves, the wigs. And it's something that's been happening for years, but it's only aggravated now because of the quality of things we get. Also just, you know, everything has become so commercialized. So we see a rapid hair loss even in women, and we only see traction alopecia mainly, which means you lose hair band-wise because of the pull. And so, like you said, it's 50% women and 50% men that we see the hair fall in.
And, you know, I've had also concerns about women saying breastfeeding would cause hair loss. Is there a linkage that you can justify, or it's just a myth that we need to also demystify?
No, it's true.
It's true?
You lose a lot of hair postpartum. And so it's not just breastfeeding, it's everything. It's the hormonal changes in the body, of course, with the breastfeeding. But postpartum is when you lose a lot of hair, and often so it doesn't come back. And that's where now it really affects the women. So if taken care of well in advance, then you can prevent extreme hair loss. But again, is why we do the hair transplants, and it's something so common that we've seen with all our patients. So, but it depends. You could postpartum not lose so much of hair, but I could. So it's also
every person is different.
Yes.
All right. So you've talked about traction alopecia, and I want you to take us through some of the most common types of hair loss, just for us to also understand the basics. Somebody could be watching and they are going through that without even knowing that that is the condition that they're actually going through. So just run us through the types of hair loss.
Okay, so it's basically types of alopecia. And we have one called androgenic alopecia or androgenetic alopecia, which is the natural balding, which could happen to men or women, but more in men than women. And so with that one, you will see that the men either bald from the top or they bald from the crown. And with the women, you see that they bald from the crown. We also have the traction alopecia, which is only from the traction and from the braiding, which is the pulling of the hair. And so traction means you pull, and so you lose hair from the front only. It could go all the way to the back, but it's only when it's very severe. We also have alopecia totalis, which means that you may not have hair in one area of the body at all. So you could have maybe just the head, no hair at all, or eyebrows, no hair at all, or no eyelashes, or just no hair on the hands. So often it affects the person when it's the eyebrows or the head. With the rest of the body, I think people just accept it. We also have alopecia universalis, which means there's no hair head to toe for the person. So we can't unfortunately treat universalis, but we can treat the rest of the alopecia. Totalis is treated. Traction alopecia is treated most oftenly with a hair transplant. And androgenetic alopecia is generally treated, well, in the first few phases can be treated with something called stem cell therapy, which is known as growth factor concentrate, or else eventually a hair transplant.
All right, so you've mentioned quite a lot hair transplant. What are we looking at now? You know, we are used to hair transplant, kidney transplant. So when you're talking about hair transplant, so what are we looking at? How does it work? What is done? Yeah?
So the best thing about a hair transplant is it's natural. When I say natural, it means that we're removing your own hair and planting your own hair, as opposed to the way you mentioned kidney transplant or liver transplant comes from someone else. And so there
So I cannot donate hair
no.
to someone else.
No,
it has to be my own hair.
Yes.
Ah, okay.
So you have to, number one, have enough hair to be able to be replanted. And of course, we also don't want to remove your hair and make you bald in one area and replant. So we generally remove hair from the back of the head because that's the strongest. Even if, for example, you see a 70-year-old man, he'll have lost all the hair, but he'll have the hair at the back. And so that is the strongest hair, and that is what is transplanted. We only remove about 30% of it and replant it in the area of baldness. And that now just grows back. There's no chances of rejection because it's your own hair. And so it's considered 99% successful.
So it's sort of like you harvest from one area, then you plant in another area.
Yes.
It looks easy when you explain it, but I'm quite sure it's not that, you know, one-time process as you. So run us through how it happens. Yeah, when somebody comes for a hair transplant, for instance, what should they expect?
It's actually very easy. It's a bit tedious in terms of the number of days. It is a one-time process. It's a 2-day process. It's an outpatient process, which means you come in the morning and you go back home in the evening, and we repeat the same the next day. So the first day, we're only harvesting the hair. and the second day is when we're planting the hair. And so that's quite the process itself. And the hair takes about 1 year to grow. There are some maintenance treatments after, which I mentioned, the GFC. So that is just the fertilizer for the planted hair. And so that is only done once a month for another 3 months. So technically, we only see you once a month for about the first 4 months. And then we leave you and your hair to grow. It takes a year for the hair to fully grow to 100%. Apart from that, we only do a series of blood tests before, which is not hectic. And after that, we put you on 6 months of supplements. So it's not so much of a complicated process. Because I mentioned it's outpatient, it's so easy because we're only using local anesthesia, which means we're only anesthetizing the back on the first day and the front on the second day. And so you can drive in and drive back out, and you're completely normal, walking, talking. We give you breaks in between. So it's a very easy, painless procedure.
So anesthesia, that means there is incision at some point that is involved?
No, it's considered microsurgery. And so our machine is literally this tiny. And we're only going into the follicle, one follicle at a time. And so it's also considered non-invasive, which means there's no bleeding, there's no bandaging, there's no dressing, there's only a small bandage just the next day after the hair transplant, but that's it. And so it's nothing tedious.
All right. What if somebody has long hair and they're losing hair on one part of their head, you know, and they still want to maintain the long hair? Or how does it work? Do you shave the hair, or how will this hair that you're planted catch up with the length of, I don't know whether I'm making sense.
No, you are. That's the worst part. We have to shave off your head.
All right.
And so it's sometimes very difficult for women to adjust because they really have to be mentally prepared. But we find that most women are okay. They want to also go bald just once, you know, in a lifetime. And so they eventually adapt to it, because in the long run, we're giving you a head full of hair. Your hair is going to grow back. Of course, it's going to take a year as well. But I often find most women are already so mentally prepared when they come in and they want to do the hair transplant. But yes, you have to shave.
All right.
It's the whole head.
But in a year, you'll be good to go.
Yes.
All right. So what are some of the things that you'd recommend for people to do to prevent hair loss? Because I know one of the things that you're very passionate about is also prevention. So in preventing hair loss, what is it that people need to consider? Things that you've seen people are doing that are disastrous to the hair health.
Okay, so as I said, because it's culture, we can't change culture in one day. And I can't tell you, look, you need to stop going to the salon, you need to stop using your gels, you need to stop using your chemicals, you need to stop doing the heat. But do all that you can, but also maintain. So I always advise my patients to use a medicated shampoo at least once a week. That's the most common problem we find when it comes to hair transplants. The skin is so infected, and it's often so hard for us to get the hair. And the infection is so prevalent because it's all the way under the skin. So medicated shampoo is absolutely necessary for every single person once a week. It's necessary to hydrate the hair, so it's always good to oil the hair. There's lots of oils in the market. We know of so many oils. Any oil is actually really okay. But the hydration has to be limited, because when you're using oil, you're blocking your follicles. So don't oil for a whole week. Leave the oil, because you're catching the gunk, the pollution, everything. You're not washing the hair. So number one, wash your hair once a week. Oil your hair once a week. Best to oil before you wash. Wash with a medicated shampoo. I think these are the two most important things when it comes to prevention and maintenance. And then, yes, if you're visiting the salon and doing whatever you want to your hair, at least you've maintained what you've done. Otherwise, we have in-house procedures, and I spoke about the GFC. That's, again, maintenance or prevention, because it's fertilizer. So it's already fertilizer to your hair before you get to the balding phase. And so it's always best if you can come in and once a year just do one GFC when you have healthy hair. For example, I'll take my example. I would do a GFC once a year just to maintain what I have, so I don't go through the balding phase. And we also do supplements. Biotin is very essential. It's just vitamin B7, and it's something very healthy to take. Biotin is widely available everywhere. So these are some of the things that you can do, you know, before you start balding or before you start going through the crisis.
At what point is the hair transplant recommended? What would you say is somebody would get to a point where now they feel like they need that hair transplant? What would you say is that point that this is very crucial for someone?
So when you've balded, you have to do a hair transplant. So whether it's traction or whether it's androgenic alopecia, if you've already balded and there is no hair in that area, there's nothing that's going to work. It's like a barren land. If you're going to put fertilizer in a barren land and there's no seeds inside, nothing is going to grow. And so likewise, if you don't have follicles, that's when you require a hair transplant. But often so we see that people come in so late that the only resort is hair transplant. We can never do anything else to, you know, prevent.
To restore your hair.
Yes.
There are options that you try first before you get to the hair transplant?
Not really, but well, we always do a consultation first.
Yeah.
And so I assess them and then I advise them. But like I said, I would say 80% of my patients come in when it's already too late. So the only resort is a hair transplant.
All right. All right. I want us to talk about also the skin, because, no, before we get to the skin, there's also this concept about, you know, we are talking about people who are losing hair.
Yes.
Let's talk about those who have hair that they want to get rid of. There's a lot that has also been done in discovering ways of removing hair that you don't want. Leave those ones who are losing hair and they want hair back. So what is being done in this area when somebody is concerned about hair growth in certain parts of the body, or they just want to get rid of certain, you know, hairs in some parts of the body? What are some of the things that have been discovered? What do you do?
So we only do laser hair removal, and that works wonders. It's basically laser, and the laser beam goes into your skin and kills your follicle. And so a series of laser hair removal sessions can completely remove your hair, but we only promise about 90% eradication of hair, which is good enough. The 10% that remains, you just need to maintain it. And the 10% that remains is so thin, it's not visible, it's very easily maintained. So it's a painless procedure. It depends on the number of body parts that you want to do. But for example, we have a lot of women who suffer from chin hair. And so that's, of course, they don't like it. And so that session would take 5 minutes. You need to do it once a month for 9 months, which is 9 sessions. And we remove 90% of the hair. Although it doesn't work on white hair. So it's only when you've not grayed is when you can do the laser hair removal.
All right.
But we do full body. So we do head to toe. And so we can literally remove your hair in any part of the body. And so it's also for men and women, because we do have a lot of men who don't like their beards, and they want to remove their beards. So
I would ask, why not just shave or wax? Well, what's the difference? That's the question.
Are you going to shave every day? It's tiring, it's boring, you have to go through the whole process. A lot of men have issues with razor bumps. So every time they shave, they come with ingrown follicles and then turns into bumps, sometimes turns into keloids, which is so tiresome. So laser hair removal, it takes care of all of that. It's a one-time, it's a 9-month process, and you're hair-free for the rest of your life. So you just avoid that tedious process. As for women, I don't advise waxing. I know it's very common. I'm not trying to kill any business, but in the long run, when you keep pulling, you're already pulling the skin. And you see a lot of women complain of strawberry legs or strawberry skin because of folliculitis, which means the follicles get inflamed and then they look red. And so now they're concerned about that issue. So there's a lot that comes with waxing. There's a lot that comes with shaving. And so this is a permanent solution. which somebody can opt for.
How safe is it? Just to demystify concerns. I was just prepping for this program, and one of the things that I came about and I said I'm going to seek clarification on was concerns about when you're doing laser hair removal. Some people are saying, oh, does it cause cancer? Does it cause, some marks on the skin? Just concerns about the safety of this particular procedure. How safe is it, and what do you do to ensure that the safety standards that are there too?
Okay, number one, laser is very safe because the length of the laser is only going into your follicle. And so it's not penetrating under the skin to deeper layers. It's not going to affect your organs. It's not going to affect anything. It's only going to follicular level just to burn the follicle. But all in all, even your mobile can give you cancer.
Yeah.
So, this thing of, aesthetics can give you cancer or
skin cancer.
Yeah.
Just concerns about the safety of some of these things that we are doing. Is it safe? That is what somebody would be asking. Okay, fine. It offers probably the solution that many people would be looking for, but how safe is it? That's the question.
It's completely safe. It's 100% safe. And we're treating a problem, so we're not going to give you another problem to the problem. And so laser or anything that we do in the facility is absolutely safe for your body. And as I said, who knows, your microwave is giving you cancer more than my laser machine will. But we've never seen cases of the laser machine giving skin cancer or any other laser machine, because the laser length is just enough to tackle the problem and not enhance and bring in another problem. Yes.
To get that assurance, what do you do to give somebody that assurance of the safety? What are some of the things that practically you do, or the process that you take somebody through to ensure that you are there to the safety standards that are required for some of these advancements?
So a lot of clinical trials have been done, a lot of research has been done. I've also really specialized on skin of color, and when you spoke of burns and marks and other problems, we often see that people just get in cheap machines, they don't know how to use the machines, and so that's how you're going to cause problems to the skin. But as long as you know that you're using the right machine, you're using the right laser lens, and you're also using the right kind of I would say quality, then you're safe. And so our research, and not just mine, but just generally research on lasers and research on skin and skin of color, has shown that there are no complications when you do these procedures. And so machines are made in such a way that they're just made for skin of color. And that's now how it works best for skin of color.
All right. What about now when you cross over to the skin? Like we started with the hair, let's get to the basics. What is it that you need people to understand about their skin? Let's begin there.
I did mention in the beginning, skin barrier. You need to have good skin health, and maintaining, restoring skin barrier means you have to cleanse, exfoliate, and hydrate. And that means that these are some things that you can do at home, but there are also procedures that we do in clinic. And we often start with procedures in clinic because we want to help you get to the good skin which you can now maintain at home. Like I said, I want you to look good in your bare skin because your makeup is only enhancing you. So you have to have that good glass skin. I don't have anything on my skin right now. I chose to come this way just to show people that this is how good skin can look. Of course, I've also worked on it. I didn't just have this good skin.
It is just taken process, and it looks really good.
Thank you. Thank you. So maintaining good skin is essential. There are so many products, so many treatments that are actually available now. We need to demystify the use of, I just use moisturizing lotion, or I just use petroleum jelly. That's good enough for my skin. No, it's not good anymore. You need to understand your skin. There's so many problems that have come with skin, with advancements, with all these years. So your petroleum jelly is not going to work anymore. Back in the day, yes, that was the only resort. Now when you have the advancements, it's always good to also take advantage of that.
One would ask, what has changed? It used to work before. Why not now? You know, there are people who think, there's a group of people who think that with all these things that women are trying, or even men are trying, these are the things that are causing these complications. What do you think?
Okay, number one, stress, pollution, food. Back in the day, we used to have such good organic food. Everything is so full of chemicals now. Stress levels, our parents never had the stress levels we have, or our grandparents never had the stress levels we have. Lifestyle, we want to match up so much socially that, you know, back in the day, they didn't have that problem. They were okay looking the way they were looking. Now we have to match up socially, and so we have to go an extra mile to do that. So all these factors contribute to people wanting and needing and having to have good skin. And also otherwise, you know, just quality of products. You know, things were so much better in terms of quality back in the day. And now because of so much of commercialization, things have really evolved. So not everything just works the way it used to work back in the day. Yeah.
All right. Do you think makeup has been abused?
I would say so.
Yeah.
I would say social media is what abuses us.
Yeah.
Because we look up to social media so much, and there's so much of formatting, editing, photoshopping, whatever, and we want to look that way. And it's actually not the reality. Even if you look at Hollywood celebrities or Bollywood celebrities, they don't look like that in their raw skin. So let's try and be natural, but let's not try and match up to what we see online. As for makeup, I would say try and buy genuine makeup. Often so also what happens is, okay, I'll buy a foundation and I'll keep it for about 2 years. Just
the
because
shelf life, yeah?
Yeah.
You look at the shelf life and whether it is still valid after those years that you've kept it.
Exactly, because I'm probably using it once a month,
Yeah.
and I don't want to throw it away because I spent 10,000 on it.
Yeah.
And you don't know what's in that foundation after 2 years. I mean, if you're going to leave bread for 2 years, the amount of fungus you'll have, and likewise, the same thing with foundation. If you're going to put it under a microscope, you're going to see tons of, I'll say, microbials. And so just be safe, you know. Also, don't share makeup. Don't try and avoid, you know, having makeup done where it's being used by so many people, because you don't know what's being transmitted. And even with, like, back to the hair, even with salons, you don't know what's being transmitted. Fair enough, everybody has their own way of doing the business, but just try and be safe. So always try and keep your skin and hair very clean.
All right. When it comes to understanding your skin, what would you recommend one considers when they're making that choice for the products that they use for their skin?
Everybody's different. I could use a product and I'll break out, and that product will suit you like anything. So, for example, my mom uses Nivea sunscreen. It works wonders on her, but when I use it, I have an outbreak. So I tell my patients, understand your skin. Anytime you buy a product, because there's so much over the counter now, there's so much education online, and people choose to go through that first before they come to see a professional or a specialist. And so just understand your skin. It's okay to buy what you're buying, but don't buy too much of it. And then, you know, have the worst skin possible. So whenever you buy a product, try it on yourself, see if it's making your skin better, if it's making your skin worse, and then you move on to another product. Often so what people do is go to the chemist or go to a beauty shop, buy tons of things because they've seen it online, use everything together, and then don't know what went wrong. So get some professional advice. There's so much out there, and there's so much that you can use. You definitely benefit from all of it, but you can't use everything. You can't have 3 meals in 1 meal. So
choose what you really
stick to basics.
All right. Yes. All right. One is looking at you and they're like, Daktari, how do I get to have flawless skin that is moisturized and clear? What is the hack? What is the secret?
Cleanse, exfoliate, hydrate. When I say that, I mean always ensure you're cleaning. always ensure that even if you've done makeup, you've been out the whole day, when you come back home, cleanse your face. I will suggest products like which have salicylic acid, which means it prevents you from having acne, probably from the makeup, probably from the pollution, because of the clogging of the pores. So that's something very basic you can do. But even cleansing with a normal Dettol soap is completely fine. You need to know what suits your skin. When I say exfoliate, we have a lot of dead skin on our face, or even full body for that matter, but the face is the most important. So once in a while, or at least once a week, it's necessary to exfoliate. You can do that with any scrub. We know of scrubs available in the supermarkets, or even just your general loofahs that you have at home. It's good to exfoliate. Don't rub too much that the skin comes off, but just enough. When we talk of hydration, when you've exfoliated and when you cleanse, it seeps out all the oil from your face. So you want to hydrate it back. You can use anything that you want. Even if you feel just a moisturizing lotion is enough for you to hydrate your skin, well and good. But just know how much hydration is important. And that you will only learn when you understand how your skin looks when it's completely hydrated. But yes, one thing that is the most important is sunscreen. And that's something most of us don't know about because we've never been taught. And sunscreen at the SPF, which is sun protective factor of 50, is the most essential. And that is what is supposed to be used. Now, one of the reasons we don't use sunscreen is because of the white cast. So when you use sunscreen on darker skin, we always tend to look whitish or purplish. And that's one of the biggest reasons people don't use sunscreens. But we have sunscreens now without the white cast. And they're still very safe, very good to use, and now is going to be palatable to a larger chunk of crowd. Sunscreen is the first step to anti-aging. So it's essential. Whatever else you do or you don't do, that's fine.
But you've taken us through the basics. You'd be surprised there are people who just don't use sunscreen because they don't consider it a priority. They say, here in Africa, we don't need sunscreen. Do we?
We do. We're at the equator. We have the longest UVA and UVB rays, which are the harshest. It doesn't mean that only when you tan is when sun is bad for you. Darker skin types may not tan, but we are also most prone to some of the most common skin cancers. And so it's very essential just to prevent. We know about it. This is education. This is knowledge. There's no harm in doing it. When I say skin cancer, we see a lot of lip cancer. And you will see a lot of people depigmenting at the lip. And it's often so painful as well. And that's because of the sun. That's because we're not protecting our skin. So it doesn't mean that only because you tan or you'll become darker is why you have to use, or is, why you have to use sunscreen so you don't tan. You have to use sunscreen just to protect the skin.
And the good thing about all your sharing is that if somebody starts today, actually they get to see results as the days progresses. And you could just start with one product, then you go on improving your collection as the days go by, and it's good for you. The skin is the largest organ of the body. You can imagine if you don't take care of it, then how are you saying that you're taking care of yourself? Let's talk about the clinical aesthetics now when it comes to, in the context of skin care. What are some of the most common issues that are currently now emerging, and how are we using or adopting this technology to address those issues when it comes to the skin health?
Okay, so the most common problems I see are acne and hyperpigmentation, which is melasma. Everybody is so concerned about it. And so we have treatments that we do to completely eradicate melasma, completely eradicate hyperpigmentation. We also have treatments to completely eradicate acne. And so these are permanent treatments. There are in-house treatments that we do. So there's a lot of less maintenance you need to do at home. And so these treatments are available in our facility. Of course, otherwise, if you have other problems, like you're concerned about your wrinkles, you're concerned about your laugh lines, you're concerned about your double chin, or, you know, for example, you want to just enhance yourself, we also have those treatments available. So when we talk about acne, we're talking about chemical peels. We do chemical peels to completely treat acne. It's actually the most short way of treating acne, and the results are splendid.
When you say chemical peels, what does it look like? There's a chemical there and then there's peeling. Now explain to us, you know, how this works.
That's actually what it is. It's a chemical, it's an acid, but it's a very mild acid. And what it does is it peels your skin because it burns your skin. But it's very safe because we follow protocols, we know how to manage it, we know how to use it. And so we guide you on the whole process. It's not a one-time thing. It's not a miracle. So it's a long process. We're talking about 6 months. And so, as you said, it talks about peel. It does peel your skin, but it doesn't mean it takes away your entire skin. It's just normal peeling of the skin. So your skin dries up, starts flaking, and then peels off to regenerate new skin underneath. And that new skin underneath is supposed to be baby skin. And so now that's the whole process, and that's the whole point of doing the peel, because now we're removing the bad, dead skin from the top and having you have the baby skin underneath.
Does it work for people who've had like acne for so many years? You have like those very notorious, you know, acne situations. They've tried all sorts of products, and the more they try, the worse it gets. Does this help also? They could be having even spots already on their skin. How do you get to realize positive outcomes with such a case?
This is actually the short treatment for acne. Whether you're a teenager, whether you're an adult, whether you have cystic acne, you'll see people who have really bad big bumps and boils. It treats all sorts of acne. And so it's the short treatment. The scars or the spots that you're talking about is what we will treat after. Because every time a new acne comes in, you'll still scar. So we want to stop the acne first, and then is when we treat the scars.
Is there any internal combination that is done? Because dermatologists have heard say that some of the skin conditions are caused not by the things that are external, but the things that are actually internal, what we consume, what happens to our hormones and all that. So how do you consider all those factors so that you get the right diagnosis for whatever condition that you're dealing with?
Look, we're all very aware of everything internally these days. We know that junk food is not the way. We know we have to eat healthy. We know we have to drink lots of water. But we're also very social. So you can't just, you can't come to me and I can't tell you, you need to stop oil, you need to stop chocolates, you need to stop this, because then you're not living your life. And so I'm one doctor who does not stop anybody on anything. I let them have their lifestyle, but I've made ways, or I've found ways of treating them with having their lifestyle. Unless it's like worst case scenario. Worst case scenario means you're just eating fries all day, every day. You're only eating chocolate, you only drink wine, you don't drink water at all. I will advise you to change your lifestyle. But I won't let you stop living your life, so to say. And so, yes, it is internal, but I think we're also aware of how to take care of things internally. And we can only advise, but we can't stop you from doing a lot of things. But we ensure that our treatment, no matter your lifestyle, still works on you. So there is a treatment that we do, which is an antioxidant therapy. It's a drip therapy. And it basically cleanses your liver and regenerates your liver. And so just saying, I mean, I don't even stop my patients from drinking alcohol. So there's no lifestyle change at all, because you may be doing the drip just to have hydration. You may be doing the drip to get rid of your melasma. You may be doing the drip to get rid of your hyperpigmentation. But it's actually a lifestyle change. Because it's regenerating your liver, everything in your body gets back into function. So the first things that you see are high energy levels, boosted immunity. Your liver comes back to normal. I'm not the specialist, but we've treated so many cases of cholesterol, hypertension, because your body is getting back in check. That was not my aim. My aim was skin, but I've seen my patients getting better just whole body-wise. And so we don't stop you on any lifestyle.
But does that then mean that you will constantly have to come back for these procedures if probably it is that thing that you're taking that is causing that skin condition?
Look, hair and skin is constantly aging. We can't stop the aging process, but we ensure that we give you a good amount of time with good hair and good skin. When it comes to hair transplants, we're guaranteeing you about 20 years, which is good enough. When it comes to hyperpigmentation, we guarantee you about 4 to 5 years. It doesn't mean that after 5 years your hyperpigmentation is going to come back in a snap. It just means that it could start again because we can't stop the aging process of the skin. And so we're there to help you maintain, but you don't have to stick with me lifelong.
All right. There's also this constant desire for people to stay young. I mean, everyone wants to. Everyone wants to look younger than they actually are. I mean, talk to me about the trends. What are you reading? Are people increasingly coming? I mean, what is happening in that line, and how do you interpret, that urge, that desire for people to look young from where you sit as an expert?
I love it. I love it when people come to me and say, I want to look 20 years younger, or I want to...
Is it possible, though?
Yes,
it
why
is
not?
Possible.
Well, no, I won't make you look 15. But all I'm saying is it's possible to make you look much younger, much healthier. And so, we tackle, when it comes to aging, we tackle problems of sagging skin, wrinkles. I specialize in non-surgical facelifts, which is a non-invasive procedure. It's not surgery. It really enhances your look. You actually look 20 years younger. And so when people come to me and say, I want to look 25, I want to feel 25, I have it for you. So like I said, the antioxidant therapy, your energy levels are boosted, your immunity is boosted. Premenopausal women get rid of all their symptoms, and these are just I wouldn't say trials, these are evidences from my patients, which they come and tell me themselves. And so they're at a point where they'll say, you know what, I don't even care about my skin, I feel so good. And so it's not just about looking young, but it's also about feeling young. And so we have all these treatments that actually give you back that confidence.
Right. When you talk about surgical, non-surgical, that's what you said. What's the difference? What are your concerns about the surgical procedures that are done to achieve some of these positive outcomes we are talking about?
I don't have concerns, but patients do. Some people don't want to go under the knife, also because it's a more permanent result and they may not need it. Some people are just scared to go through the pain and, all the whole process of going under the knife. So when we say non-surgical, we're only creating very small incisions on the side of the face, which actually don't show. And then we put in a product called a thread, which dissolves in your skin and regenerates your own collagen and tightens back your skin. And that's why it's non-invasive. So I give my advice to my patients on what they can do, and then it's up to them whether they want to go under the knife or this will work. Because maybe a non-surgical may not work for everybody. You may be too saggy for me to lift completely. You need a surgical facelift. So it's always best to get advice.
All right. Let's talk about, some of the things that you recommend are done post some of these procedures we've talked about. And there are many. I mean, the list is just so long if you go out there to just look at, what you can be able to explore when it comes to clinical aesthetics, just to achieve what you want to achieve in terms of how you look. There are so many. But then what do you run patients through? The post-care, just to sustain or maintain whatever it is that they have achieved, because it's a journey, we both agree. So how do you get to sustain? For example, you wanted to look younger and that has been achieved. So how do you remain younger? Maybe there is, you wanted certain parts of your body to be reduced or something to be done. Like for women, want flat tummies. I mean, everyone wants a flat tummy.
Yes.
You have that. How do you maintain that after you have achieved it?
So there are slight lifestyle changes, especially when it comes to weight loss. Or looking slimmer. So you've probably done weight loss. That's one of our best treatments actually that we have. We don't do the surgical one. Or you've probably done a lipo and you want to maintain. You have to maintain with your diet. But there's a lot of maintenance that you can do at home, even when it comes to skincare and hair care. But I tell my patients, do what you can afford. Don't go out there to buy 20,000 worth of products and you can't afford that 20,000. And so I really stick my patients to a very basic regime. Back to point one, sunscreen. That's enough. I tell my patients, if you can't even afford a cleanser, please don't use it. Even a Dettol soap is good enough. So what you can afford is what you spend on, and that's what you use. There's lots to maintain. Yes, maintenance is key because that's the only way you're going to maintain what we've achieved for you. But otherwise, we also have maintenance treatments. So we have hydrofacials, we have microneedling. These are some of the maintenance treatments that you can come and do with us once in a while. So for example, you've done a facelift, you can come back after 6 months and we can do you a microneedling. Or you can come back every month and just do a hydrofacial because it's not expensive, but we're maintaining for you. So you don't have to do a lot at home as well.
All right. As we close this conversation, I wanted to talk to just sort of like a word of caution. In this era where everybody wants to look good and achieve whatever it is that they want to achieve with regards to how they look, there are people who've come into the business and there's been a lot of commercialization of some of these things, some to the extent of even misinforming the public on how to go about this. Just talk to us about some of the safety precautions that somebody can take before trying anything. What are some of the things that you're supposed to consider?
Okay, we've always been taught what is basic. Like, yes, we know sunscreen is good, we know moisturizing cream is good, but don't do what the internet is teaching you, or don't do what people are teaching you online. We had an instance where people were being taught how to do procedures that we do in the clinic at home. And that's not what you're supposed to do because you don't know how to deal with the complications. You don't know what will go wrong. And so don't do things what you're not supposed to do. Stick to your basics. Seek professional advice. There's no harm in you just coming in for a consultation and just understanding what you need to do. We're not forcing you to do the treatments, but at least you have an idea. Don't go and buy those back market products because you don't know what they're doing. Don't believe that, oh, glycolic acid is so good just because I saw it on Instagram and it makes me look like Bella Hadid. No, it doesn't. So have your knowledge. Yes, knowledge is power these days. Yes, Google says everything, but we're also professionals. So come and seek advice before you do anything.
All right. There's somebody who's saying, I may want those I may want to go the recommended direction, but do I have to break the bank to do the right thing? That's an interesting concern.
Well, not really. We're not breaking the bank for you, but we do have a consultation fee. It's a one-time consultation fee. My consultation fees are 5,000 Kenya shillings. It's just a one-time, so when you come in later, we don't charge you again. But yes, I'm sure there's consultation fee everywhere. So nice. Wherever you go to, whoever professional you go to, you will have to pay.
All right. Thank you so much, Daktari, for creating time to join us this particular morning. Of course, I know people are very passionate about how they look, and I believe from this conversation you have been able to gather what is it that you had wanted to know concerning clinical aesthetics. I've been having this conversation this morning with Dr. Ashni Malde. She's an aesthetic doctor, also the managing director of Tia Clinics. A lot that we could have talked about, but just sort of like breaking the surface for this conversation. Asante sana for watching the program since we started the show. Until now, we really appreciate your company and for your engagement. Those of you who took time to share with us your thoughts on social media, we appreciate as well. My name is Safina Chengoma. Have a lovely day ahead.